Don't talk
Yes, that is the sound of a human pulse, because we're going to get healthy this Thursday, talking about diagnosing medical conditions by listening to the pulse. It's something that Dr. Elie does in her work at the Nourishing Medicine Clinic. Now, you diagnose things like colds, flu, insomnia, just by listening to that sound?
Yes. Oh, actually, it's feeling. It's more like feeling the pulse as opposed to listening to it.
Yeah, she doesn't put her ear on your wrist. She puts her finger on your wrist.
So tell us how it works. How do you go about figuring these things out? Is it a faster pulse? Does that determine something?
So typically in Western medicine, we think about the pulse rate being either too fast or too slow or maybe just right. But in Chinese medicine, the way that we think about the pulse is actually the quality of the pulse. Oh. So when I'm feeling somebody's pulse here, I have three fingers.
Are you sure you don't want it on your ear?
Let's see what it says. So I am feeling for the quality of the pulse. So is it what we would call wiry, like a guitar string? Or is it really weak? Is it we call it scattered? It's like almost like putting your finger on a bowl of Jell-O, right? Oh. That feels really different than a guitar string, right? You can imagine that.
What would that scattered indicate? Because I'm sure that's what you're feeling.
You've got the bowl of jelly pulse. Congratulations.
And that indicates what?
You won't be here on Monday, Kathy.
She won't be here. She's off. You're right.
It works.
It means there's improper blood flow to that particular organ system. So I feel the pulse on both sides of the wrist, the right and the left. I use three fingers in different positions. So on the right hand, we have, we can tell how the blood is flowing through the sinus area and the head. The second one is the digestive area. The third one is the urinary and kidney bladder. And then on the other side, the first finger I put down is on the heart, and then the liver, and then the adrenal glands, hormonal stuff.
Now, you tested Drew's pulse earlier.
It probably would not be good for your practice to compare the sound or the feel of my pulse versus Kathy's, right? That would probably not be a good practice to compare.
Well, I've found that I have inadequate blood flow to an organ, so now I'm very concerned.
Do you know which one it is? But you did feel mine.
I did.
And?
Oh, Drew.
But I had to say, I was hustling into the building. I was hustling into the building. I imagine it was fast. That probably indicates.
Yeah. No, the main thing I felt was when I felt the area of where your heart is, it feels like you do not get enough sleep. Are you tired?
Oh, I'm glad to know he has a heart.
It's not a restful
You
heart.
too.
No, of course I don't. I go to bed late. I wake up early.
You got twin boys.
And I nap in the car.
Yep.
Yeah.
Sleep
so
is horrible.
that shows up in your pulse.
The only thing worse than my sleeping habits are my eating habits and my exercising habits. But other than those three areas, I am
You're
very
doing great.
solid.
Other than your entire health, you're good.
Well, he made mention of the rate of the pulse, being up because he was rushing into the building. Does the rate matter, or just what you feel?
The rate does matter, but not as much as it does like in Western medicine. Yeah, in Chinese medicine, more about the quality. We want to know how the blood is flowing through each organ system.
Are there some very common things you do find in people, or some weird things that people never would have guessed you could figure out?
Yes, and a lot of the things that we can diagnose, they need to go to their MD and have a proper diagnosis. But for example, it's very common for me to feel someone's pulse and I can tell if they're at risk for type 2 diabetes or for fatty liver disease. So when I feel that in the pulse, that's not a definitive diagnosis. Right. You have fatty liver. Right. No, they need to go to their doctor and get tested.
Hey, have you ever been checked for this? You may want to.
Right. But it's a red flag for me to say, hey, here's something I think you need to be tested for. Yeah.
So it's not something that then you would diagnose something to fix. I mean, do you diagnose an herb or something like that to help
so
folks?
Basically, what's the point of diagnosis? Well, we need to know, okay, what's going wrong? Where is the blood not flowing well in the body? And then from there, because I'm a Chinese medical doctor, then I will go, okay, this is the kind of acupuncture I will do on you. These are the herbs I will choose for you.
See.
These are the lifestyle changes. These are the dietary changes.
We did take a shot there of the chart. Hoisted up there, or I guess placed up there, leaning, and that is what you do. Like you say, you really keep track of the different types of pulses, and this helps you.
Yeah, because as I'm treating a patient, as we go through a treatment plan, their pulse changes, right? And it should, because as I'm giving them herbs to increase blood flow to their liver, for example, I want to see their liver pulse change, right?
Sorry to interrupt, but how often do you recommend this?
So when I see patients, I always take a pulse, the first visit, and then if they're doing herbs, then I'm going to follow up with them each time they come in. Typically, my patients come in once a week.
Okay.
Yeah.
Do you make the appointment now, Kathy, or do you wait till after the show?
She's like, let's get this done.
Kathy will make that appointment.
Dr.
She will make that
Elie
appointment at
the
the Nourishing
Medicine Clinic.
I'm sorry.